we have Peggy Sloma. Peggy earned her associate degree in dental hygiene from Ferris State University and has been practicing dentistry for over 35 years. Whew. How can that be? Her first 20 years were in clinical practice and the next 16 in dental sales with Colgate Oral Pharmaceuticals. She is the first dental hygienist in Michigan to implement a PA 161 program, on-site dental hygiene services at a nursing home facility. She served as Grand Rapids Dental Hygienist Society past president, stays active in her local component. She is a member of the Geriatric Dentistry Coalition. Peggy Sloma.
Is that good? Ah, I can hear myself too. Well, I'm the hygienist that fell out of the sky, right on in front of Bonnie. Just to give you a little history, like Bunny mentioned, I've been a practicing dental hygienist for many years. I worked in private practice for about 25 years and had many opportunities to have hands-on experience with the geriatric population. And what I'm kind of feeling here in the crowd is that some of you have families or maybe even patients of your own in your office, and you know someday they're going to maybe be in a facility that they're going to not get the dental care that they're getting now. When I was in hygiene, I really enjoyed what I was doing, but I was kind of looking, down the road, another avenue, and that's when I got the opportunity to go to work for Colgate Oral Pharmaceuticals. And maybe many of you know me from coming in the office, but I worked with Colgate, and part of that position, besides talking about Colgate products, was educating, going to conventions, being a speaker to components in groups, and also managing my business. And I think that's what I'm hearing here, and I think that's what we forget. Even when you're in your operatory, you're managing that business that you're doing there for that dentist. With that thought, when Bonnie and I met in 2006 in Lansing, I was working at the MDHA Dental Convention, and she was strolling down the hall, the exhibitors' halls, and I looked like she was on a mission, and she had this notebook, and she came up to my booth, and I said, hi, Bonnie. I says, what's happening? And she started talking about PA 161, which, I hadn't really been active at the component level like she has. And she explained to me that she had just introduced the new law of having an on-site dental hygienist work in a nursing home. And she had just had Meadowbrook on board and very excited about having a hygienist there to do preventive care. Well, as we're talking, and I love to tell this story, but my face must have changed because she could just tell how interested I was. And I was at that point, a year and a half ago, I was getting close to retirement from Colgate. Colgate gave me the opportunity to travel almost all of Michigan and Indiana and Ohio, but I'd reached the point that I didn't quite want to travel that much, so I was looking for retirement. But I'm wired, and I think many of you as hygienists are wired not to really leave your profession completely. So I thought maybe this is kind of what my destiny was to get into a practice, a business type situation like what I have now. So that is what brought me to Meadowbrook, was basically Bonnie talking to me about PA 161. Meadowbrook is, if any of you know where Bel Air is, it's a small village. It's, if you were to go Cadillac, 131. Do any of you ski or snowmobile? Yeah, do you? Okay. You probably know where I'm going, right? We're going north. And you go 131, you might even go by our cabin. We do have a cabin up there. I don't, drive from Grand Rapids up to, Meadowbrook every day. But you get to Mansalona, then you go west or take a left. I think is it Shanty Creek up there? Yep. You go past there, and there's a little village called Bel Air, and that's where Meadowbrook is. And that is where our nursing home is. And you can see it's a beautiful location. And we have now had the program going for about almost 2 years. I know that Dolly and I were just talking about 2-year renewals coming up here. This is a collaborative practice, and I really kind of enjoyed the other speakers because we were talking about networking. And I thought about this slide that I made up the other night, is that the nursing home residents are definitely underserved. What I found when I came in there, that most of them are not getting good just day-to-day oral hygiene care. They are so limited that these people might not even get their teeth brushed once a day. And so definitely there's a need for us to be in nursing homes. Our networking and a collaborative made me think about that we're all working together. You know, this is where the MDHA, the community, and the dental hygienists are all trying to serve these underserved residents in a nursing home. Meadowbrook opened their doors. They became the model for other nursing homes in a way that they see the big picture of what a need there is. If you think about nursing homes has physical therapists there, they have vision care, they have the medical doctor, but they don't have dental care. So, you know, why is that not being met? And that's where PA 161 is our answer. I am connected with Dental Clinics North. They are a dental clinic. They have about 10 clinics through Michigan. They accept Medicaid and low-income patients, so it was a perfect fit for me to have them as our provider. And they were familiar with Meadowbrook, so that was kind of nice because that door was easily opened when we presented our program to them. I'd like to talk about my support system at Meadowbrook. Marna Robinson, the administrator, she was the front runner in this program. She worked at Meadowbrook as a teenager, coming in there as working like as a nurse's aide. She became an LPN and then an RN. She also is a dental assistant, so she understood the care. And if you can kind of get somebody in there that really understands that need. She was so welcoming our program. She has been able to give us so much that has made this successful. When we first started the program in October of 2006, we did a facility introduction, which I called it kind of like a mini open house. I came in and I introduced myself to the residents. I walked around, gave out toothbrushes and toothpaste. It was funny because, you know, some of those people, they would say, well, I don't have any teeth, you know. I'd say, well, that's okay, you know, we just want to make sure that your mouth is comfortable. The staff is great. You know, some of them need some education too. You know, a lot of the staff there personally don't have very good oral hygiene. So there was a door that opened there for me to talk to them about their personal needs. The nursing staff, I deal with the nursing staff. They have a care plan quarterly on every resident, which means they meet and talk about residents and what their needs are. So my chart goes into their care plan so that they know how that resident is doing. Is there an issue? Do we need to work on oral hygiene? Maybe that resident needs a new denture, you know, has a cracked tooth that's been irritating the mouth. So now the nursing staff has something they visually can see on a quarterly basis. The other thing that was really encouraging for me was the nurses don't feel that comfortable doing an oral assessment. It is required by nursing homes that every resident that enters a nursing home has an assessment of their mouth. Well, you know, you think about, they'll look in that mouth quickly, but they might not be able to identify some problems, or, you know, they're not really aware of some things that could be going on. And so they really said, this is great. You know, we have somebody here that's a dental professional that can now do that. I have a person, Lori, my unit clerk. She is my sidekick, my, my person that I work with every time I'm there. She has been with the Meadowbrook for 25 years. She knows every resident. They are a community. One thing about geriatric people is that they do not like strange things. And if they have somebody they know and trust, they're more apt to be more cooperative. And Lori is one of those people that can come up to one of my patients and say, Harry, open your mouth for Peggy. And she'll kick him in the foot and say, come on, show her your choppers, and she just can get people to change. I have to tell you a story where I had one woman that was, a lot of them are, limited mentally, they're very limited. And this lady did not want to see me. And the nurse's aide brought her in, and she wouldn't open her mouth. She just had this look on her face that she wasn't happy. And that woman reached and grabbed that nurse's aide's hair, just like that. Now, when I see aggression like that, I just say, it's not going to happen today. They wheeled that little lady out, and 2 minutes later, she was wheeled back in with Lori. And I'm looking and I'm thinking, Lori, this isn't going to happen. The woman's either going to bite me or hit me or what. And it was just night and day. Lori says, do you know Peggy? She's going to look at your teeth. And she goes, no, I don't know her. She was just there 2 seconds ago. So, it's just a different area to work with these people, but it's so rewarding because there's the staff there that knows just how everything, clicks. My clinic room, you'll be able to see a picture later. When we first went to Meadowbrook to present our program, and they were giving us a room to set up, we opened the door, and I know Bonnie's laughing, but have you ever had a closet that everything that you don't really want to throw out yet, we couldn't even see the walls. There was a popcorn machine, there was things for outdoor activity, balls and papers and that, and they said, this will be your clinic room, which, I thought, right, where do we go from here? Well, from that time on, every time I went in there, it got better and better. They painted the walls, they put a new floor in, they put all the necessary outlets in there, and then our cabinetry got delivered. They put that up. So the whole room turned into a clinic room. Now the advantage with that for the nursing home was now they had a room they could use when other doctors came to visit, because my position, my program at Meadowbrook is about 2 days a month. So now they have other doctors that can come in and use my room. So it wasn't just set up for me, but it is my room. Yeah, that's true. We laugh because I can go in there and there's things that were left behind from other visitors. Supplies, Meadowbrook has been very generous. They have many of the supplies you would use in a dental office, your paper towels, your bibs, your gloves, your asepsis. And Marna, the administrator, said, this is part of the nursing budget, so when I need something, it's there for me. And the other thing to really open up this program to the community, and like Bonnie was saying, there are so many organizations in your area. You might, you have Rotary clubs, Lions clubs, even your local components. If you went in there and sold this program to them and show them the benefit to that resident, it's surprising how generous they can be. Well, what we did, and I think I lost that. Oh, I might not need it. Okay, I'm done. I can move on. We had an open house at Meadowbrook, and the nurse and Meadowbrook, what did I do? Oh, okay. There we go. We had an open house at Meadowbrook that basically Meadowbrook paid for by sending out, I would say, about 600 flyers to the families of the residents, to the businesses, to the dental professionals in that area to tell them this is our program that we are offering to the residents. And can you imagine if you were in that community and you were thinking about having your mother, father, whoever go into Meadowbrook, that you knew they would be getting this service too? So it was great to have that, and it really was just making it known to the community that we were there. These are some of the contributors. I know Sheila and some have addressed grant writing. I think that's an important area. Unfortunately, I'm not skilled at that, but the nursing home has a grant writer on staff. She wrote grants, and we did get one from Michigan Dental Foundation, and then the other contributors there, you can see that we have, the Northland Dental Hygienist Society donated money. The clubs, we also did get our cabinetry from Dr. Perrin. That's our beautiful cabinets. Dr. Thumb from Mansalona, he had a dental chair that he had donated to the nursing home. It was actually in a storage area. They call it their barn, which is a barn. And that was a beautiful dental chair that was just there for years. So we brought that down, and we were able to purchase with the monies that came from the donors many of these equipment. The laptop computer, now to kind of explain how our program runs a little bit differently than maybe some of the more independent program, is that my laptop computer is donated by Dental Clinics North. They are my provider, so that's who I refer the residents to. They have a Dentrix program. So what I do is, like if you were in a dental office, you just enter in all your procedure, and then it's billed through Dental Clinics North because they accept Medicaid. So all the communications I do on that patient goes directly to Dental Clinics North. So we were talking about that, liability issue. I feel very comfortable we are covering all the bases because we have now a mobile x-ray unit and the digital x-ray sensor. Have any of you have sensors yet in your, isn't that great? I mean, you take an x-ray, you can delete it, and what I can do is send those x-rays right to Dental Clinics North, which is wonderful because when we have to refer our residents to them for any treatment, they have the x-rays there. I have a mobile dental cart. Mine is more of a mobile in the sense that it's all self-contained. I guess I could take it and move it to a different nursing home, but it's on wheels. I have the scaler and the other equipment that you would have in a dental hygiene room. And there's some pictures of our room. The chair that we have is a nice chair, but I have found working with the elderly that's really still kind of intimidating for them. Bonnie and I are going to a mini residency seminar on working with geriatric patients, and we're looking forward to that because they're going to be talking about equipment and that too. My operation at the dental clinic is I do oral assessments, and I had the question once, and I thought, I guess if you don't use that term, somebody asked me, what is an oral assessment? What oral assessment is basically doing a charting of existing conditions. As hygienists, we can't diagnose and we can't treatment plan, but it does, we have to have something of record. And so when I do oral assessments on all the residents, even if they're edentulous, that is entered into the computer, so we have a baseline. Data collection, that is in the works. We're collecting the data on oral hygiene and improvement in that, but I've yet come across something that I can take with me that really I'd like to use as a standard. So we're working on that. And then all the other things that we're doing, which, in a regular practice you would. The oral hygiene instructions for residents and the certified nursing assistants. Have any of you worked in a nursing home or had to do any kind of like an in-service? No. Yeah. Did you see a big gap with the understanding of oral hygiene? We'll have to talk. Maybe you can help me. I can talk to the residents, but you know, they're limited because of their disease and health issues. But I have people come in to see me and their gums are just beet red, and I can take a toothbrush and brush the gums clean. I mean, it's been food from how long? And I know those nurses' aides are busy. They have, 10 people they got to get out of bed, down to breakfast, wipe bottoms, change clothes, all this. So, I'm trying to focus in because I want them to be part of the team. So we're trying to work with them, on understanding what they have to do for their patients. And then we talk about recommending specialty toothbrushes. I kind of thought everybody should have a powered toothbrush when I went in there. But, some of your elderly patients don't do well with things like that in their mouth. So we've looked at different things that could be used. I follow up with the residents. I cruise the halls. I can look and say, I saw Mrs. Jones last month, and she wasn't brushed that well or hasn't had, been able to. And those nursing assistants know I'm coming around, and it's kind of, I'm not trying to police anybody, but it's just like with any of you. If you don't tell your kids to brush their teeth every night or pick up their clothes, what happens, Ends up they've got a floor full of clothes and they haven't brushed their teeth in a week. So I kind of follow that where I want to be part of the staff and communicating with the dentist. That's what's so great about our Meadowbrook program is that I've got a source to refer to. This is one of our residents. I think Bonnie had that same slide. I kind of call this gentleman here, he has his roommate. They're kind of like the hall monitors on their end of the wing. They sit out in the hallway. There's a lot of activity in a nursing home. I mean, sometimes you got to find your patient. They're someplace else. Well, they'll sit there and talk to everybody that go by, and I says, you're kind of like the bad boys at the hall. They like that. So, great. They're really great people. This young lady here, she probably wouldn't be at Meadowbrook except she's not able to, move about, get around and take care of herself. But she has great dental care, and she is always coming in and asking me about this tooth and that tooth. So, people that really ask you about their teeth, they really care. A funny story I have to tell you is when I first started at Meadowbrook, Marna, the administrator, wanted me to do oral assessments on everyone. There's about 118 residents there, and none of them had been seen by a hygienist per se on a regular basis. So we were doing the assessments where I was charting everyone. Well, when I came in, there was an announcement on the loudspeaker, and all the assistants knew they had to get their residents down there for that day. I had people in wheelchairs in the hallway like this. This is a learning curve for me too. And they would leave. The assistants would go because they had their resident there. And I'm like waiting, I go out in the hallway and there's some of them that are nodding off, some of them that can't really talk that well. I did not know who they were. I'd say, what is your name? And so finally I just said to Lori, I said, Lori, we've got to do something about this. I says, I've got them, I have to know who they are. So guess what they did? Do you have those yellow Post-it notes? They all had yellow Post-it notes on their arm. I said, someday I'm going to be in that nursing home in a chair with a Post-it note on me. But you have to look at the humor of it, because they're just great people. The other thing that we can offer to nursing homes is a in-service education program. It is mandatory for the nurses to have a yearly, like a CEU that we would have to hear about dental care. When I'm in there, I introduce myself, the dental clinic, just what my services are. I educate on the importance of oral hygiene, the special need for patients, and that was one thing that we found out. There's certain people that have hard time opening their mouth, not understanding they need their mouth open, so we talked about different mouth props and also in selecting toothbrushes. I think what I learned most about this when I did my in-service is don't over-educate. I went in as a hygienist. Plaque, oral, systemic, connection, this. I must have had 10 slides that were just for my presentation. What they wanted to know is, how do we get them to open? How do we brush their teeth? And just the basics you'd think. We all take it for granted. We know how to do it. So I made it really hands-on. I made it fun. And I think they enjoyed that, and they deal with problems, every day with these patients. Some of them have bad days, some of them have good. So, we talk about just, how to get them to cooperate. That slide's been around. I don't know where I got that, but Bonnie had the same slide. I think he should get a little bit of a royalty on that, right? Okay. But I put that in my presentation with the nurses because that shock treatment, that they really see that. That's kind of that thing. They go, oh, gross. And then they say, yeah, but my patient looks like that. My resident looks like that. And then I do try to touch on, explain to them why it's important, that the mouth is clean and that connection between the bacteria in the mouth and the bloodstream. And also, this is really kind of a fun area because there's probably a lot of websites out there when you need certain, tools and different types of brushes. There's many that, you could offer to the residents. What I see with Meadowbrook is, because they are just the model for nursing home, is if I go to the administrator or the nurses and explain, we need some of these specialty brushes in, they will order them. Because they do supply toothbrushes to the residents, but they're just a standard toothbrush. What's next at Meadowbrook, and this is real exciting for me, is right next to the Meadowbrook facility is apartments that are there for the underserved, low income, and they are looking to put that under their umbrella. So if this does happen, I think it will in the future, they will purchase those apartments, and then those people at that apartment can come and be part of our PA 161. And also Meadowbrook is planning in a couple years of adding an expansion and adding offices in that community where they could have, their residents, but also the community to be able to come in there and get dental care. And what's next for the dental clinic? I look at it personally that I'm going to continue with those residents. I'm going to learn along with them. I'm providing them the dental care that's needed. Addressing complex dental problems. That is an area where you'll see such a difference because we're so used to, when we see our patients, if a tooth is broken, we crown it. If this is going bad, we take care of it. Well, you have people that have limited abilities, limited incomes, and so you have to kind of streamline, customize that dental plan. So we're working on that dental need for that patient. Not everybody is going to be able to have a crown, so what's our other choice? And then working with that limitations that the residents have. And equipment, we haven't spent all our money yet. So they just told me last month, he says, we have money there, Peggy. What do you want us to do with that? Can you believe that? And I'm going, oh, okay, I can spend it. So we're looking at, possibly a wheelchair that's more customized for the resident that can't get out of a wheelchair into my dental chair. Also looking at new dental chairs that won't be too intimidating for the residents, and also the lights, because as you know, if you don't have the proper lighting, which I'm finding that's a limitation with my setup, it's quite hard to work on them. Aging is a privilege. I keep thinking that. That's true though. We're here, and a challenge. I look at it like an opportunity, and this is how PA 161 is. It's an opportunity for those of you out there that really would like to go into an area that is in dire need of hygienists. And I do have business cards here too, so if any of you'd like one, I have those. Any questions?